The Henryton State Hospital Center, or the Henryton Tuberculosis Sanatorium as it was called, was erected in 1922 by the Maryland Board of Mental Hygiene. It was established as a facility to treat African Americans suffering from tuberculosis. This was one of the first such facilities in Maryland erected to provide African Americans with the same level of treatment as whites. Established in 1922 by Chapter 464, Acts of 1922, the original complex consisted of 6 main buildings and 1 utility plant. These buildings were erected between the years of 1921 and 1923. The establishment of the Henryton Sanatorium was one of the final steps in Maryland's program to treat all of the state's tubercular patients. In the late 20s and early 30s, the tuberculosis rate among African Americans in Maryland was quadruple what the rate was among whites. This placed a heavy burden on the hospital to deal with the increasing number of patients. In 1938, the hospital was budgeted $270,000 for the construction of new buildings to house 200 more patients. The new buildings roughly doubled the size of the overall facility, and several more municipal buildings added even more space to the complex. However, by the time the new buildings were completed in 1946, the tuberculosis rates had dropped, leaving much more room than was necessary. In 1963, the Maryland Board of Mental Hygiene and the Department of Health merged to become the Maryland Department of Health and Mental Hygiene. As part of the act that created the new department, Henryton Sanatorium became the Henryton State Hospital Center. The hospital ended operations as a tuberculosis treatment facility and was converted to serve as a facility for the training and rehabilitation of severely and profoundly retarded ambulatory residents ages 18 and over. The hospital was not used as a facility to treat the criminally insane, contrary to the popular belief. The location and layout, combined with the almost total lack of security, not to mention the complete lack of anything remotely resembling prison enclosures, would not have been conducive to the complex serving as even a minimum security facility. At the time the hospital reopened in 1963, there were 200 residents living at Henryton out of the allowable 330. Once the renovation and conversion of the facility was fully completed in the early 50s, the maximum occupancy was 400 patients. The rehabilitation program was a great success and returned many of its patients to their respective communities and some to the workforce. Admission to the hospital was covered by the Mental Retardation Administration, a division of Maryland Special Services, for new patients and through the Rosewood State Hospital for patients already receiving care elsewhere. Henryton also ran a respite care program with admission by special request. The American mindset in the late 70s and early 80s shifted from institutionalization to more outpatient and home care, which led to decreasing resident numbers at Henryton. The Maryland DHMH decided to end the training program in 1984 because of the low numbers of enrollment and residents. In 1985, Henryton had fewer than 100 resident patients and operations at the center were being phased out. By the fall of 1985, the facility was emptied, locked, boarded up, and closed for good. Henryton State Hospital was not present on the Maryland DHMH budget for fiscal year 1986. In the decades since the facility's closure, the Henryton State Hospital complex has become a haven for vandals, drifters, and drug addicts. The facade of most of the buildings have been extensively damaged and are covered in graffiti. Most of the windows have been broken out, making the grounds around the hospital very dangerous. The doors to all of the buildings have been broken in, allowing access to the inside. Although the furnishings and equipment were removed before the facility closed, there is still remarkable damage from people going through. Henryton has been the site of many suspicious fires since its closure, the most well-known of them taking place in the early morning of December 19, 2007. In this incident, the auditorium and cafeteria sections of the complex were engulfed with flames. The blaze took 80 firefighters from 3 counties to extinguish. The burned areas have since been demolished and removed.
Ahead of us.
Visiting the Henryton State Hospital complex without the express written consent of the Maryland DHMH is trespassing, but the possible charges and fines seem not to deter most vandals. However, the decades of wear on the buildings without maintenance and the presence of large quantities of asbestos make Henryton a dangerous place to explore. Since its closing, many attempts to purchase the land have been made, but most potential buyers, after having been approved to buy, have had their proposal for usage vetoed by local government and the like. The land on which the old Henryton Center rests goes on the market occasionally every 5-6 years or so and then is removed from the market. The state of Maryland spends a large amount of money to maintain the property, minimally and occasionally patrol, and it is an expense that the state seems eager to be rid of.
Interesting.